Hi, I am Dr. Rishi, a senior dermatologist as well as the co-chairperson in Delhi's Sir Gangaram Hospital in the Department of Dermatology. Today I'll be talking about the bacterial infections and how do we prevent them and how do we diagnose them and maybe even treat them and what are the precautions that we need to take. Bacterial infections, commonly for people, we know the bacteria invades your body. And the bacteria could be of various varieties. It could be just Staphylococcus, the most common one, the Streptococcus. Then we have the other kinds of bacteria, the Nocardia, the other Klebsiella, and you name it, and we have so many names. And what happens is that the skin barrier of a person could be broken either due to various diseases like atopic dermatitis or surgical wounds, or the skin barrier could also be broken because of various accidents. And the bacteria manages to seep into the body. The clinical features are very, very simple. All the clinical features of inflammation, the cardinal features of inflammation. That is the redness, the swelling, the pain, the warmth, and inability of the area to function properly. For example, if I have an injury here, so I cannot use my finger properly. When the infection really goes from bad to worse, we need to remember that it can lead to, fever, rigors and chills. The patient may suffer from septicemic shock. Shutdown of various major organs can happen, and it can even lead to death, if we do not take care. What the people who get this kind of an infection are the extremes of age. Anybody, children under the age of 5, elderly population, people who are prone to getting ill, for example, pregnant women whose immunity is down, cancer patients, any hospitalized patients, we call them the nosocomial infections, which are passed on from person to person. And the way to prevent this kind of an infection is that, we maintain a good hygiene, hand washing. While touching something, the thing should be very, very clean. And the investigations that we can do for this, although they're obvious, but the complete blood count, including the ESR and the C-reactive protein, can be done to see the immediate response. And the swab culture, the blood culture, the pus cultures can be done, and we will have a good idea. And this is very, very important in this era of, antibiotic resistance. For example, we have the MRSA, the methicillin resistant Staph aureus. This is happening because of the rampant use of broad spectrum antibiotics. We need to understand that if the lesion, if we have one or two pustules, for example, what are the things that can happen to us is cellulitis, erysipelas, we can have impetigo, we can have the superficial folliculitis. These are the various kinds of, pitted keratolysis. We can have various other bacterial infections, which can be there. But we need to treat them with a lot of caution. I personally do not use any antibiotic, if the lesion has just one or two pustules, I just leave it. If it is more, I use normal antiseptics, not antibiotics. If it is much more than that, then I use pseudomonic acid or the fusidic acid. And if it is getting out of hand, for example, we see the complications like fever or the hemorrhagic or the septicemic shocks and the rigors and chills and the muscle aches and the myalgias and arthralgias, then we go for a broad spectrum antibiotic. This also, the care should be taken, that throat swab should be taken, the blood culture should be done, the pus culture should be done. If it is not, if the antibiotic has already been started by another doctor, I do it under bachelor. This is something that I always tell people. So the use of antibiotics in today's day and age, we should remember that since 1987, we haven't found a new antibiotic group. And the population since then has doubled. We are 7.4 billion earthlings now. So we have to use antibiotics a great amount of care, and we have to be very, very careful, trying not to abuse the antibiotics. So there have been several papers written on this, and the whole meaning of this talk should be that for a small little, killing an ant, we should not use a bazooka gun.
For more such videos, visit or log into DermaVidya.com.